أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما. Well, after that we come to our pharmacology, a new topic. It's about the GIT, pharmacology of gastrointestinal tract. Number of medicine related to their effects on GIT, they are mentioned at certain other pharmacological groups. So we will also mention them over here. In addition to particular terms and diseases, those will be discussed. So can you recall some of the diseases related to GIT? Just note down. Hope everyone has got a pen and a pencil, pen and a copy with him, and write down the date and name of your teacher if you want to write. Note down the topic. Say I gave over here certain diseases and subtopics related to GIT pharmacology, like you might have heard about the antacids. Generally, antacids means you are giving substance to neutralize the hydrochloric acid in the stomach. They are also given this name, gastric antacids. It means the main effect is there in the stomach. So you will be taught about the gastric antacids later on. There will be one lecture about it. Then related to it, another term you will come across, the acid peptic disease. Acid peptic disease. So, as the name indicates, acid and the pepsin, they have got corrosive action on the GIT, especially the upper GIT over here. So, acid peptic disease. Previous name about the disease was peptic ulcer. So also note it, you may be asked about it, peptic ulcer. Say 50 years back, I had gone through one book where it was written as psycho-ulcer, psycho. Still a number of conditions they produce ulcers in the upper GIT or otherwise. So stress ulcers, ulcer related to surgery, etc. So you will also have two lectures around about the drugs used in acid peptic disease, inshallah. Then another topic is about the drugs which increase the motility of upper GIT. They are also known as prokinetics. Prokinetic. So be careful. Don't mix it up with pharmacokinetic. It is prokinetic. Prokinetic means the they increase motility of upper GIT, prokinetics. Well-known examples you have already studied, like metoclopramide and domperidone. We also discussed them related to GIT. Then another word, say the spasmolytics. These are the medicines which suppress the spasm. They relax GIT, spasmolytics. Especially, you have also gone through certain drugs which relax this smooth muscle of GIT, especially. So, can you recall? So, well-known examples say the atropine, hyoscine, etc. These are the antimuscarinic, anticholinergic drugs. Certain other drugs are also included among these spasmolytics. Then another subtopic you will study, it is about the drugs which evacuate the bowel, known as laxatives. So they evacuate the bowel, act on the lower GIT. So they have certain other names, these laxatives, synonyms with various effects according to the potency, like you will also study, you will given 2 lectures about laxatives, inshallah. So they are also known by other names like the aperients, also named as cathartics according to the potency. These terms you will not be able to go through the new books, but in multi-author they may be present, or you have to see the internet for these older terms. Cathartics. So then other subtopic you are studying in pharmacology, it's about the antiemetics. Over here, antiemetics, they are used to treat nausea and vomiting. There will be say around 1 or 2 lectures on it. Antiemetics, nausea and vomiting is to be controlled. Different groups of drugs they are used to treat this nausea or vomiting later on. So they have good place, antiemetics in pharmacology. So there are also one small group, not very common now. It is emetics. The word is emetic, emesis. So only few drugs are mentioned about it. They have got this emetic effect. They produce vomiting. Say in case of certain poisons, just to be thrown out, emetics. Now rarely used. One well-known example is apomorphine. Apomorphine. You are familiar with, hope you are all familiar with morphine. You appeared in the very recent test for the narcotic analgesia. This apomorphine, it has got emetic effect. So antiemetics, emetics, then few other groups like the drugs to treat irritable bowel syndrome, IBS, irritable bowel syndrome. You will be given some knowledge about it, irritable bowel syndrome. And similar word, another disease which is covered over here, that's the inflammatory bowel disease, IBD, inflammatory bowel disease. Inflammatory bowel disease. Then about another term is ulcerative colitis. Specific medicines are there for these diseases. They affect different parts of the colon. Ulcerative colitis. In the recent Viva conducted online, I was asking about sulfasalazine from students, but they were not satisfying, not given proper answers. Sulfasalazine, so because it's used at different places, so you must be familiar with it. Then other certain other substances or different terms are being used in related to GIT. I'll show you the some of the slides, and these terms are commonly spoken or even asked in your Viva OC. So let us start about that. So I'll discuss them one by one. Hope they will reach you, and everybody is alert with his pen and copy. Certain extra things taught over here will be asked later on, so be alert. Here you see a word sial, sialagogues, salivation, sialagogues. Sial is about salivation, and gogues is the flow. The medicine, in certain cases, if the mouth is dry, proper digestion is the problem and it's affecting dry mouth, that's to be treated with these medicines to increase the salivation. Dry mouth, you may be familiar with the word xerostomia, X-E-R-O, xerostomia. Mouth is dry and it is to be treated. Xerostomia. Say the eye is dry, that's known as xerophthalmia. So sialagogues in certain autoimmune diseases, as Jargon's disease, the mouth is dry and it must be treated because the saliva has got certain protective effects in the mouth, and so you should be familiar with it if someone comes with a problem. How the salivation is to be increased. Here you see how the salivation and dry mouth is. A few salts are written over here, say the potassium salts, potassium iodide, iodine, and mercury salts. So in very small amount, as they are secreted over here in saliva, so while created they produce this more saliva. So about the mercury salts, you know, they have got toxic effects. So not used to, rather you might have studied this mercury salt in the diuretics, mercurous chloride. So you know mercury deposits in body, so toxic effects. It is just for theory purpose. Then another group among the sialagogues, they act reflexly. So here one is the stomach aches. It is not the ache like headache. Stomach aches, they improve digestion, improve the secretion overall of GIT. Then the emetics in very small dose, as previously told, very small dose, they increase the salivation, emetics. After that, here is one very common group, very important. You study it there in autonomic nervous system. These are the parasympathomimetics. Mimetics means similarity. I mean, if the parasympathetic system is stimulated, then you know the secretion will overall increase. You must be familiar with it, with the cholinergic drug or like the anticholinestases. I mean, they are parasympathomimetics, are directly acting. They increase parasympathomimetics. So they increase. After the next slide, we come to parasympathomimetics. Over here, few examples are written, like nicotine, as smokers they use it, inhale it. Nicotine and lobeline, they have got this stimulant effect on the salivation. Lobeline, you know, these medicines, they are in liquid form. Nicotine, lobeline, this is our question. And pilocarpine, you should know what is pilo and what is carpine. So very small dose used to stimulate the salivation. But next, after that, where you to use these sialagogues? First thing, you have already been told about it, xerostomia, dryness of mouth. Then about the saliva, salivation, it has certain advantages, like the you see it's continuously washing your oral cavity, which is blessing, and also at buffering phase. Then if there is no proper salivation, so it's written that there may be caries, dental caries. Then candidiasis, it is from candida infection. You see the whitest patches in the mouth or in vagina or in your ear, candidiasis. And also another problem, if the salivation is not proper, the dental enamel, that is demineralized. After that, if the salivation is more, in certain diseases there is more salivation and people have problem and they come to you to sir, please, I have to say deliver lecture and my mouth is dry, one of the examples. Sialagogues, even with certain diseases there may be more salivation and you have to suppress if it is excessive. So first group over here, it is opposite to the parasympathomimetics. Previously you have been told. So well-known examples are these are the prototype drugs. Scopolamine. What's the other name for scopolamine? If you not familiar, write down hyoscine. Atropine. These are prototype drugs of this group, parasympatho. They are over here it is written parasympatholytics. They have antimuscarinic, antimuscarinic, anticholinergic effect. Then another group written about salivation is to be blocked or suppressed. It is a well-known group from history point of view. These are autonomic ganglia blockers, though not you know, but you should have knowledge about the prototype drug for ganglia blockers. What's that? Hexamethonium. Some member of it may be used or special indication is there. So hexamethonium or hexamethonium man, all of you should know about it. Then demulcents, they have soothing effect on the this oral cavity, and then astringents. You should know astringents. They have got this effect on the proteins. So they also suppress this astringents. They suppress the salivation. This term is again given stomach aches. In general, it means the substance to improve digestion, improve appetite. Appetite is a problem. Say the appetite is suppressed. So the technical name for this is anorexia. Anorexia, maybe anorexia nervosa. Appetite. So stomach aches, if the appetite is suppressed, and you have to go, and then appetite is to be improved, say with the appetizers. And stomach aches, these substances they reflexly increase salivation, not only the salivation but also the gastric secretion. So improve the stomach function. Next we come to, they are sometimes asking your viva. Stomach aches further classified, those they have effect, local effect, the bitters. Bitters, as the name indicates, so bitter substances they increase the salivation. The number of spices, the ladies are familiar with spices more than the boys, and they can, I'll show you later on, so they can well recognize this, nicely prepared by Dr. Pracha slides. She knows how to prepare these slides, and then I am asked to broadcast it. So spices you will be shown later. Here come certain medicines. They are used to, in case of anorexia, loss of appetite, which is common in your age, also among the aged people. So they find it difficult to eat. So certain important drugs are given over here, used to increase to stimulate the appetite center produced. One is Pizotifen. Pizotifen. You will study it later on, or you might have studied earlier. Pizotifen. Then cyproheptadine. Cyproheptadine, this is a H1 blocker, also anti-serotonin, number of other effects it has got. So then the Buclizine is also given here to improve appetite, Metopine. So these medicines, in general they produce sedation. So the drugs which produce sedation, they are better to be given at what time? To be given at bedtime, rather better. As the food is, you are giving to improve the appetite, so better give half an hour before the food, or like that. Other substances which improve this digestion, there are different flavors, volatile oils, number of volatile oils are there. You should be able to say, at least recall 5 at this very stage. Previously, the senior teacher, they used to ask just name 10 volatile oils. So then beverages, mashrubat. So you people, you eat this food, your special food, like the what is that, burger, and also use this Coke or 7-Up with it, and give good amount to this KFC or the McDonald's. The same thing you purchase in hundreds, which can be purchased from other sites, better is in less money. So be careful. Next we come to the again bitters. According to the taste, they are known as bitter. Certain substances, bitters, they have the bitter taste. Irritate the receptors, also stomach mucosa, increase the secretion as previously told. A well-known example given over here is Quassia tincture. What is tincture? Note down. These are alcoholic substances of vegetables or animal substances. They have good quantity of some quantity of this alcohol in that, maybe 20 to 40%, even up to 90%. The addicts, if they don't find the proper alcohol, they start taking these tinctures. Those paint the doors, tinctures. Spirit is there. Wild ginger, ginger, white. Ladies can translate it. Ginger is adrak in local language. Then another substance written over is the wormwood. You have to see worm. What is worm and what is wood? It is tincture. Then mint is pudina, pepper is mirage, peppermint is what is that? Peppermint. Is it dhania? Go through it. Mustard is sarson, and these are also digestants. Again, there may be overlapping. Digestion, you have to improve digestion. These are the substances that promote digestion of food. Food has to be digested. So number of enzymes are given over here. They have the lipolytic enzyme, amylolytic, lysis, breakdown, proteolytic enzyme. People to take it, if they feel the food is not properly digested. Dyspepsia, where they are digested are you, dyspepsia, what is meant by the word dys, it is difficult, pepsia. Pepsin is related, it is related to. Then also they stimulate appetite. If someone is taking more food, the disease is known as, in the class I had told you, bulimia. And well-known example of bulimia was the Diana. She was a problem, and they go on eating things. Appetite stimulant. So the digestion, they are used as health tonics. These substances, say the hydrochloric is a very small amount, very small concentration. So it improves this digestion. You know hydrochloric acid has got very important effect in the stomach. It has got number of physiological effects, maybe ask you. So if the HCl is not produced due to certain disease, recall what disease is there. So the condition is known as achlorhydria. A means absent, chlorhydria, hydrochloric acid not problem. Then pepsin is given in case of gastric chylia due to atrophic gastritis. Also may be indicated in gastric cancer, pernicious anemia. Then another enzyme, papain, it is proteolytic enzyme. Then pancreatin, given in case of chronic pancreatitis. Then diastase, anti-diastase, pancreatic insufficiency, amylolytic enzymes. These are different enzyme preparations given to people who find it difficult to digest food. Here you see beautiful pictures of some of the spices. All the girls are familiar. Hope if they bother to visit their chicken in spite of giving order to the outside KFC, etc. Lutrum putrum, you know, to get the same thing in, and they have plenty of no problem about the spending. So they, in spite of preparing these substances in their home, they get it from outside, which is wrong. Then here you see a number of beautiful spices are there, and their oils may be used, also used in kitchen. So let's go to the next. Peppermint. First one is the peppermint. Then ginger, you know, adrak. What I know, I'll translate. Otherwise, you have to translate. Coriander is dhania. Coriander is dhania. Then caraway is it zira. Caraway, translated clove, long, cinnamon. What's that cinnamon? Is it darchini? Fennel. What is this fennel? So there are may be used as such. Rosemary. So I can't translate rosemary. Rose is gulab. Mary, I don't know what is it. Then carminatives. Well-known example of carminative. You prepare it in your lab the carminative mixture. So it has got certain substances which are used to expel this flatulence, to relieve flatulence, that a gas problem. Expulsion of gases from GIT may be indication, may be indigestion, flatulence, and certain substances used for as carminative already discussed. In addition, sodium bicarbonate. Over here, sodium, you know, HCl is being neutralized. Sodium bicarbonate, it is antacid, systemic antacid, note down. Then peppermint oil, also in this carminative mixture what you make here in your lab, it is called tincture cardamom. And then tincture, maybe there ginger. Another word related tincture is the spirit. In case of spirit, they are substances in which alcohol is there, and the other substances in the spirits, they are usually volatile oils. And another important question asked previously, in past, what are the differences between fixile and volatile ions. Just please note down and go through it. At least you should know few of them, if not all, are volatile oil and fixed oil. Please note down. Here is tincture ginger, then and dill oil. I was going through this dill oil. The word in Urdu, it was written as soya, something soya. Then also this chloroform water is used in the carbonated mixture, then maybe some quantity ether, then volatile oils, then carbonated water, cola beverages. Here you then appetite is to be suppressed. So they have another word, anorexians. The word over anorectics or anorexians you should also note. I mean, if some problem is there, bulimia is there, and people go on eating, so it is to be suppressed. Number of medicine they are used to suppress appetite. You know, this to be overweight is a big problem, so must be managed, and medicines be taken as a last resort. Before that you have to control it, and certain if psychological problems are there, I mean, do exercise, have low caloric diet and proper exercise, so the appetite is to be suppressed. If it's a big problem and you are gaining weight, you know, weight is a big problem. It has multiple adverse effects on your body and life. Here you come across how the appetite is to be suppressed. So there is center for hunger and this satiation, which is located in hypothalamus. So if it is suppressed, then you can suppress the eating. The number of sympathomimetics. If you go back, sympathomimetics, so can you recall which of the sympathomimetics they suppress food eating this problem? So amphetamines, number of amphetamines used for this person. Amphetamines. Here a few more other things, substances are written over here: amphetamine, chlorphentermine, mazindol, like that. Next one is amphetamines. Not different amphetamines. If they, you know, the students take this amphetamine to to remain active, to appear in exam. Amphetamine. These are adrenergic drugs, and they have got number of adverse effects. Then one is serotonergic, serotonin effect, fenfluramine to improve. Serotonergic, fenfluramine, Sibutramine. At the end it is methylcellulose. And what is methylcellulose? You study in purgatives. I mean, they increase the volume. Bolus volume they increase, and one feels that there is no need to take any more food. After that, methylcellulose, here we come to main indication to suppress the exogenous obesity for short-term use. A number of other things you must consider before taking the medicines to control it. It has a number of problems. You know, slimming centers are there, and they are good amount from rich people to reduce the caloric restriction, exercise, behavior modification. Here you see, better do